Good morning. My name is Michelle Miller. I'm the Human Services Administrator for Human Services here in Martin County. And May is Mental Health Awareness Month, and we're here today to help raise awareness about the issues surrounding mental health, specifically here in Martin County. And today I'm joined by Lisa Reimer, who is a Communications Officer with New Horizons. Welcome. And
thank you for having me.
Thank you for being here today. And we are here today to provide information specifically regarding services that are available to our county. And I understand that New Horizons is the largest provider of mental health services on the Treasure Coast.
Yes, it is.
Is that correct? Mm-hmm. So can you begin with just telling us the types of services that you provide and to whom?
So first of all, we are in 4 counties, Martin, St. Lucie, Indian River, and Okeechobee counties. We serve 15,000 children and adults annually, regardless of their ability to pay. In fact, almost 60% of our clients have no source of income or any insurance, yet no one is turned away due to a lack of financial resources. We have inpatient programs at our main campus in Fort Pierce on Midway Road, which is open to all Martin County residents. We have a detox program. We have a 28-day substance use and alcohol program. We have crisis programs for children and for adults. We also have a transitional group home for people who are coming out of the state hospital and transitioning back into mainstream society. So that is our inpatient program repertoire. So our outpatient, we have 3 outpatient offices here in Martin County, all in the 1111 building on Southeast Federal Highway, that allows for a continuum of care convenience. So we have outpatient therapy, counseling, case management. We have groups. We also have in the same building our medication-assisted treatment, which is pretty much brand new coming into Martin County. It is a harm reduction approach to the opioid epidemic. It also, so basically what that is that you are getting a shot to keep your cravings and your withdrawal symptoms at bay for opioid addiction, but it also is good for alcohol. So it's either Suboxone, which is like a 30, I think you take the pills or the pieces of medication every day. But then you can also do Vivitrol. So the Suboxone is for the opioids, but Vivitrol is both for opioid addiction and alcohol addiction. And so it keeps, like I said, the withdrawal and the cravings at bay. That's the MAT, medication-assisted treatment. That's second office. We have the outpatient office, then the outpatient MAT program, and then we also have what's called the Martin County Learning Center, and it's psychosocial rehabilitation. It's a program for classes. These are for people who may have been homeless or have been living in supervised circumstances such as jail, or in an institution, or people who just need to learn or relearn basic living skills. We do things like medication management so that they don't stop taking their medication. They don't forget to take their medication. It's an important part of the whole recovery program. Anger management, learning how to cook, learning how to take the buses, the transportation systems, learning about nutrition, not just cooking, but learning about nutrition, you know, how to go and read the labels, what to do if your stuff isn't, your favorite foods aren't there on the grocery store shelf. Basic pre-employment training, things like writing an email, putting together a resume. We have people who work with them who, with our students, we call our clients that go to the Learning Center students. We have people who will connect with them about housing, so that they are and most of these people are part of our program, but it's not even necessary. If someone, for instance, has someone living in their home or knows of someone that could benefit, they can self-enroll, they can be referred by an agency or a doctor elsewhere for psychosocial rehabilitation. And we are the only people, the only agency in Martin County that provides adult psychosocial rehabilitation for mental health services. And there's also the social element, barbecues, field trips, because, none of us are an island. We need other people to, feel good about ourselves and to thrive. And that's the goal, is to make sure that New Horizons is one of the options in Martin County to make sure that people are whole, that they feel valued, and that they have the opportunity to live with dignity and have quality of life. So, that is why we have community mental health agencies. So those are the three outpatient programs in Martin County, and then we have the inpatient programs in our main campus.
So it seems over the past year these services have increased, especially here in Martin County. And do you think that's due to the pandemic and the increases that we've seen for requests for services over the past year, or was that something that was already in place and may have just expanded a bit?
Well, so that's a little bit of a complicated answer because, first of all, while we had this pandemic, we still had an epidemic going on, and it sort of like lost its forefront of our thinking, the opioid epidemic. And just to give you some, there have been five overdoses, fatality overdoses this year so far in the first 3 months in Martin County. And in last year there were 47. So, that is still going on. And people do deal with, on a regular basis, depression, and, suicide is the second leading cause of death in young people 10 to 24. So last year there were 30 suicides in Martin County, and so far this year there are 10. So one of the things that we have seen is that in the beginning of the pandemic, we didn't really see a spike in requests for services. Why? Because people were very concerned about their rent, their food. Everybody was sort of in a state of shock. FEMA suggests that the psychiatric impact of a disaster hits 18 months after the disaster is over. So here we are, hopefully, in the final stages of this COVID era pandemic. And so we really don't know what to expect as people go back to their lives and there aren't the same jobs. The housing is the housing market, you can't even keep houses on the market, and the rental prices are just astronomical. So we're not sure how that's going to be played out. We have bolstered our services, such as our mobile response, and we can talk about that. Mm-hmm. But so we have seen some spikes, and then we've been waiting for the other foot to fall, as they say.
To see what happens in the future. So let's talk a little bit about mobile response, because I feel that's such an important part of the services that you provide. So can you talk a little bit about what it is and then how someone can utilize it if they are facing a crisis?
Yeah, I have to say that mobile response is one of the most special programs at New Horizons. We are the only agency in a 4-county region that offers mobile response. We are open 24 hours a day, 7 days a week, 365 days a year. It's a calling for our people. We have master's level mental health professionals who work the mobile response team. What happens is that you can either call 211 if you are in a crisis, or you can call our number, which is 772-468-3909. That 24-hour helpline is always available. You call, you tell the person who answers what the situation is, and they will, if you have questions, if you have concerns, if you say, I need someone now, so they will talk you through it. You can call about your family members, you can call about yourself, you can call about your neighbors, you can call about a friend. So you can call, and then if that call needs a mobile response, then they will put you, right through to mobile response, and they'll have already apprised them on the situation. And in some cases, they're working in the same department, so they're just right next to each other. And then we will either dispatch someone, and sometimes, especially in COVID, a lot of these calls have been able to be handled over the phone, simply because during COVID, we are hearing from people who have never had a mental health issue before. The isolation, the level of uncertainty, the anxiety. If you're older, even if you're a single parent, what are you going to do? You have your kids, you've lost your job. Those kinds of questions are coming up more often than not. So some of these things can be handled over the phone. Some of them need a mobile response. So if we do dispatch mobile response, and incidentally, 211, if you call them, they have their crisis line. If they think you need a mobile response, they will call New Horizons and dispatch us to that location, wherever it is. As long as you can give us a point of latitude, longitude, we can get there. It doesn't have to be a house. It can be a park. It can be a parking lot. And we work very closely with law enforcement. In fact, in the Martin County Sheriff's Office, one of the things that they have done to drive down mental health 911 calls is do a proactive approach, so that we are calling people who have in the past had those kind of calls and say, hey, how you doing? Do you need help? It's COVID, how can we help you? So we've been doing that. But if you call mobile response, somebody will come out with no signs on their car, no white jackets. It's a personal car, or it looks like a personal car, one of our agency cars. And they just come in and they talk. The goal is to de-escalate a situation, to avoid like a Baker Act sort of situation where a person is involuntarily committed for 72 hours for assessment. That may be required, but the goal is to avoid that, to de-escalate, and to come up with a game plan going into the future so that they have like a sense of, I know what to do next.
And is there a cost for that service?
No, there's no cost and there's no time limit. It's really like an amazing service that that is offered to the community. Children and adults, you tell them over the phone and they will send the person that's best suited for that. We have had calls from, for instance, there was a call from a wife and her husband, and he was a veteran, and he just did not believe in therapy, and and so she didn't know what to do, and he was becoming more and more distressed, and so we sent out someone, and basically they came in and talked, and they noticed, out in his garage that he had like some artifacts from his past, and so they started talking about the artifacts, and then before you knew it, an hour and a half had gone by, and our representative said, so what do you think about therapy now? And he goes, what do you mean? That was just talk. And she goes, that's all it is, just a conversation, someone that you trust. And he said, yep, I'm ready to sign up for therapy now. So
that's great.
Yeah.
And you mentioned that you work with a lot of other agencies, and I feel like that's so important to emphasize. 211, the Sheriff's Office, I know you work with Fire Rescue. So having all of these agencies work together and then funnel to you for your services is an important resource for the community.
Yes, and more than that, no one agency can handle the great demand, especially looking forward to the 18 months, like I said, from FEMA. So we work very closely with other agencies, Tykes and Teens, Helping People Succeed, LaHaya, we refer, they know that they can't handle everything, we can't handle everything. So, there is, and even with private doctors, and we work closely with them.
Right, so it is a true community approach where everyone works together to, help provide people with the services they need and point them, like you said, to where they can best get those services. And then finally, if you can just talk a little bit about another program that you have that I think is really important to the community, and that's your peer program, and how that helps walk along somebody that needs that type of service.
So, throughout the mental health field, peers have become a much more valued resource. And a peer is someone who has lived experience. Right. So they may not have the college education in psychology and clinical and social work, but they have lived recovery. And so a peer support specialist goes through a certification program, and it's actually quite rigorous. I mean, as much as 500 hours of volunteer work. So again, we have this tremendous commitment from the people who are serving in those roles, not just to help themselves, but to help others. And in recovery, that's a very important part, whether you're recovering from substance use addictions or mental health. So it's an important part to feel that you are valued, that you are contributing back to society. So for instance, in our MAT program, and this is a national model that we've adopted in the last couple of years at New Horizons, if somebody overdoses and is called in, and New Horizons is notified, if they're a client of ours or if they are just, we are notified because, you know, they need to be affiliated with someone that's going to help them in their recovery. We send a peer out into the emergency room, and it's not a hard sell. It's not like, come on, you need to, you know, quit drinking or quit, you know, shooting up. It's, here's my card. I know where you've been. I know that if I could do it, you can too. Please give me a call. Do you need a ride now? Do you want to come with me now to a meeting? You know, those kinds of options. And it's been very successful. We have peers that work in our MAT clinic with our group therapies. We have peers that work in the psychosocial rehabilitation. Also, again, you know, people who have been perhaps, you know, heavily medicated, institutionalized, who are now living, you know, pretty good lives. And they say, you know, if I can do it, you can too. So.
And if somebody is interested in obtaining a peer support, can they just call your main office to get that, or do they have to be referred to one, or how does that work?
Well, so there's information online. So we don't do the peer training at New Horizons. Most of our peer training is being done, I believe, through the Southeast Florida Behavioral Health Network, which is our managing entity. So they do provide some of that training. You can just go online. There's an online class. The in-person classes, I'm not sure, have resumed yet, and they were free, but the online classes were pretty minimal cost, and it's great learning anyway. So if you're interested in that, you know, you start with the online class, and then you would reach out, yes, to New Horizons or another agency and say, I've taken the initial training, and I'd like to start my volunteer hours. And then I believe the volunteer hours, then it culminates with perhaps another, you know, a test or something. So there is a certification process.
Well, all of the things that you mentioned today are great resources for our community. And if you can just close by saying how somebody can contact you to get more information, or again, if they are in a crisis.
Okay, so everything is online at www.nhtcinc.org. That's New Horizons Treasure Coast Inc.org. And you can actually type that out, because nhtcinc.org is a little bit hard to remember. Or give us a call at 772-468-5600. That's our general information line. Again, our crisis line. And if you go onto the general information line, it will repeat this. But you know, it's always good to have this at your fingertips. Is 772-468-3909. So that's our crisis line. And you know what? If you can't get the answers you're looking for, give me a call. I have my desk phone rolled into my cell phone, 772-672-8333.
And also 211 in the event that someone is, you know, just really having an emergency, they can contact 211.
Right, you can always contact 211, and they will dispatch from New Horizons if you need a mobile response.
All right. Well, thank you, Lisa. I really appreciate you taking the time to be with us today. This information is so valuable, and I hope that the information provided today is information that the residents can use should they need it, or are they looking for services. So thank you.